This is an election year. What are the priority issues for you and those in your family? Let's talk about some of the priority issues for AARP based on our membership and what we're hearing from people who say that this is an important election year and you want to be sure to vote. And to talk about those, we have with us our Regional Vice President, June Lyle. So glad to have you with us again.
So happy to be here, Paula.
And you have, let's talk about you for a moment. You have how many states that report to you?
9 states.
9 states. And overall, AARP's membership throughout the country is about,
about 30
million. 30 million people.
Yeah.
And all of you know that we do surveys all the time to find out what's on the minds of those who are 50 and older. So tell us what we're learning.
Well, we know that people are really caring right now about some of the things that help make them able to live their lives the way they want to. And those are things like Social Security. Those are things like Medicare. Those are things like how do they give and provide care to the people that they love, their loved ones who need care and support. And then an increasing issue that we're hearing a lot about right now is fraud. People are really concerned about what they need to do to protect themselves from frauds and scams, which are off the charts in terms of the number of people that are being impacted.
We hear that all the time. We work with the Michigan State Police as well, and they said, like, even with crypto fraud,
yes,
it has increased like $100 million in the last year. It's ridiculous.
Yeah. These are these ATMs that you can see in gas stations and that sort of thing, and people are getting all kinds of frauds and scams, and some of them are losing their entire retirement savings to these crypto ATM frauds.
And there's some states who have banned the machines,
there
right?
are actually 2 states, possibly 3 now. Indiana, Tennessee, and I believe Minnesota have outright banned crypto ATMs due to a lot of advocacy by AARP and other organizations looking to protect consumers and particularly seniors.
Right. And people don't need to go to an ATM machine. I mean, we're not saying that crypto is bad, but they don't need to go to an ATM machine for the transactions. That's right.
Yeah, this is something very crypto in general. You know, that's a bigger picture, right, but it's these crypto ATMs that are really the issue. Yeah.
And so what else are we hearing? I know AARP just did some really, I think, fascinating research on caregivers.
Yes. Yeah.
And they called it valuing the invaluable.
Yeah.
Valuing the invaluable.
Yeah.
And caregivers are like the heart of America, really, in terms of what they give every day.
Yeah, they are really the backbone of our long-term care system. Family caregivers are the ones that provide the vast majority of care. Mm-hmm. And this is to people who need help with bathing or dressing or transportation, sometimes even with complex medical tasks. And in the vast majority of situations, that care is being provided at home by a loved one. And what AARP set out to do, and we've done this research over many years, but this was the 2026 update, is to try to put a dollar value on what that would cost if we actually had to pay those family caregivers for the care they're providing. And the numbers are mind-boggling, Paula. Here in Michigan alone, we know there are 1.5 million family caregivers. And if you tried to put a dollar figure on the care that they provide at about $20 an hour, which is kind of the standard for what paid caregivers get, you're talking about $27 billion a year in the value of the care that they provide. So these are folks who are giving so much. We need to do more to be able to support them.
Absolutely. And as you know, here in Michigan too, we're looking at a caregiving tax credit.
Yes.
Some relief for those folks. I mean, they have to put, whether it's building a ramp or whether it's the transportation or putting bars in the restroom or whatever they might be, they're going out of pocket for that. And I think there's something like $7,500 out of pocket expenses. And what I still can't figure this out, and you know me well. We actually would save the state money if they just reallocated more dollars to home and community-based services. Yeah. So for every dollar we spend to send someone to a facility, you could save $2 if you let them stay at home. Yeah. So just giving more of a break to family caregivers. Yeah. What else are you hearing? I mean, that report is, I love the title, Valuing the Invaluable, because they are invaluable to us.
They really are. And I think you're exactly right. Our long-term care system is kind of backwards. It makes it easier for people to go into institutions, which is not where they want to be. And it costs more. It costs more to families, and it costs more to us as taxpayers. So by doing things like providing more home and community-based services, which I know the Michigan State Office of AARP has worked hard to increase, and then also doing these things like providing a modest tax credit to family caregivers to give them just that little bit of help. It is, I hear this from caregivers all the time. It is a blessing to be able to take care of a loved one, but it is hard. It is hard emotionally. It's hard financially.
Yes.
It's hard from a time perspective, and anything that we can do to just give them a little bit of help so that they can continue to give that care to their loved ones in their homes and communities, which is where they want to stay, is really the right thing to do.
Absolutely. And, people, particularly legislators who are listening, I know all of you are, who are listening, sometimes people want to talk about the dollars and cents versus the emotional part of that, or and the dollars and cents just support this 300%.
Absolutely.
That it makes sense to do that. It saves the state money. It helps the caregiver. It helps you win re-elections because older adults vote. I think 53% of older adults in Michigan vote in every election. So if you're listening or you know someone who has the influence in the legislature, tell them, please support this tax credit. And you can see how you can support it by looking at the link on the screen. What else are you learning about the national priorities?
So I would like to talk a little bit about Social Security, just because we're heading into an election year. I suspect we're going to talk a little bit more about that. But Social Security is really a critical issue for our members. And, we know that a huge proportion of Social Security beneficiaries, it is their primary source of income. And it's just essential for helping ensure that people have good quality of life and that they are able to live comfortably as they age. Another important thing to remember about Social Security is it's an earned benefit. We all paid into it, right? And we want it to be there when we retire and when we need it. And AARP is fighting across the country and raising this issue as an election issue, but we're also working in the halls of Congress day in and day out to say we need to pay attention to this. And the reality is that Social Security does face some long-term financial challenges. With the Social Security Trust Fund, we know that as of 2034, so we've got a little bit of time, but not that much time, by 2034, Social Security will not be able to pay 100% of promised benefits. It will be down to about 81%. And I don't know about you, Paula, but I want 100% of my Social Security benefits, not 81%. So Congress really needs to act. And I encourage AARP members to reach out to their member of Congress and let them know how important Social Security is, and that they'll be thinking about that when they go to vote.
And people think, oh, that's not going to happen, or that's too far away. And it dawned on me that those who we vote this time in this election will be the ones making the decision about Social Security in 2034. So it's important to ask every candidate, not do you support Social Security, because they're all going to say yes.
Right.
But what are you going to do to protect and preserve Social Security and make certain I get my 100% of my earned income?
That's right.
And that's for this election cycle, because if they get, they win another cycle, they're the ones who are making the decision. So we need to pay attention. I can't imagine, though. Can you imagine? You just think about this. 30 million AARP members across the country, they're 50 and older, and someone tells them they're only going to get 80% of their Social Security. Folks, you don't want to see that.
That's exactly right. You want to talk about an election issue that will get people really deeply concerned and upset. It's thinking about losing some of their Social Security benefits. So I think it's really incumbent on our current members of Congress and folks who are running for office right now to really be thinking about what they can do. And what's interesting about Social Security, when we did a fix on Social Security back in the 1980s, and it was a bipartisan solution, the solution isn't that difficult. I mean, it's going to take some compromise and it's going to take some discussion, but it's not that hard if we can actually get people to sit down at the table and figure out the math to make Social Security solvent for the long term. I want Social Security to be there for my kids and my grandkids.
Absolutely. And again, like you said, it's an earned benefit.
Right.
So just think about, you're losing 20% of your earned benefit by 2034 if they take no action.
That's right.
That's not acceptable.
It's not.
It's not acceptable. So talk a little bit about AARP in general in terms of, not only their national priorities, but how they get this information. What do they do to collect this kind of information?
So as I think viewers of this show are probably aware, AARP is a nationwide nonprofit that's really focused on helping people who are 50 plus live the lives that they want to live. And we do this in a variety of ways. We do advocacy. We've talked about that, and we're very active here in Michigan in front of the state legislature and also working with members of Congress. We also do a lot of work to go out and educate people who are 50 plus about things that matter to them around health and fraud and voter engagement and lots of other things. Another important part of AARP's work is we have a really strong research arm, and in fact our Public Policy Institute does some of the best research on some of the issues that we've been talking about of anybody in the in fact I would say probably the best, the gold standard. And AARP puts resources behind making sure that we've got the best, most reliable data that we can use to help advocate for policy decisions, to make sure that our congressional leaders and legislators and other policy members, governors, have good data and information to make decisions. And it's a really important, and it's the foundation really for all the work that we do.
And I love that. I love reading and seeing that data. And what is kind of interesting is when we go to Washington and we lobby, our members of Congress, or here in the state, they always ask us about our data.
Yeah.
They trust that data.
Yeah.
And that's what I think we are, the most trusted resource of people, because you can always, we used to say in school, there's data, and then their lives, but you can always trust AARP's data is legitimate. And as you said, fraud is one of the areas that older adults care about. Caregiving is another area, and Social Security. But I want to focus and of course, voter engagement. We have websites, and please visit our website. That has changed a lot too in terms of where you vote, how you vote.
Right.
In Michigan in particular, there is another effort to make certain that people submit their driver's license or their Social Security number when they ask for an absentee ballot.
Right.
And of course we want, only citizens voting. Everybody wants that, but you want to look at the details there to see whether or not they're saying in order to get an absentee ballot, if you have to submit your Social Security number, the last 4 digits, or your driver's license number, because of some of the fraudulent activities associated with that. That's scary.
Yeah.
It's really scary.
Yeah.
And that's not just here, all across the country, right? There's issues with voting. So make certain that you're registered, that you know where to vote, how to vote.
Yes.
And again, when you go to the coffees and talk to the elected officials, we want to make certain that you ask the right questions, not just protecting Social Security, but what are you going to do about it to make certain that it's there. I know you've been very involved with the caregiving. Talk a little bit more about what AARP is doing regarding caregiving. We're looking for a tax credit, but nationwide and in Congress, what's happening?
Yeah. So AARP is really leading the charge at the national level in terms of making caregiving a priority issue for members of Congress. And this is really something that's changed quite a bit, I think, in the past 10 years. 10 years ago, I don't think caregiving was really seen as a public policy issue. And I don't think that there was a lot of understanding of who family caregivers are, what do they do, how important they are. So that we've improved a lot as far as that is concerned. We have a very active agenda at the federal level to fight for family caregivers, and at the top of that list is a national family caregiver tax credit, and that has been something that AARP has been, fighting for a number of years. It's a challenging time in our nation's capital right now in terms of getting things done, but we continue to fight and make the case for that all the time. We recently had a big National Lobby Day that I know you participated in, Paula, and went and met with members of Congress from states across the country. And one of the things that we were advocating for was the caregiver tax credit. And then we have a variety of other proposals in front of Congress to lower costs for family caregivers. That's really a big priority for us. So that is baked into our DNA. We will continue to fight those fights and continue to make that case. And as you said earlier, this is a situation where the numbers and the right thing to do line up. It makes economic sense for this country to invest in family caregivers and provide them support because they're the backbone of our long-term care system. If they were to go away and say, hey, I'm done with this, we would be in really big trouble.
Absolutely.
And it's also the right thing to do.
Absolutely. And again, people may not even know that they're a caregiver, but because I was surprised when I started AARP, if you go to someone's house and you mow their lawn and you take them to get groceries, you're a caregiver.
That's right.
All right. right?
Yeah.
We fought a couple of years ago to make certain that the individual could select who they wanted to be their caregiver. It didn't have to be family.
Right.
So AARP's been fighting this battle for quite a while.
Yeah.
And so I think this is going to be our year. I really think this is going to be a year.
I hope you're right. I hope you're right. And who you vote for in August and November may play a role in that.
Absolutely. The other thing, in terms of playing a role, and I still, every time I talk about prescription drugs, I always thank Senator Stabenow, because I think she fought that for 20 years. We were successful with that. So talk a little bit about that that nationwide.
Yeah, so AARP fought quite hard, and this has been several years ago now, to ensure that there is the opportunity to negotiate prices within Medicare for key prescription drugs, and we've seen that kick in this past year in terms of the initial round of drugs were selected and negotiated, and we saw significant reductions. I will also mention we just recently, within the past week or so, had an important development on that front. So you think you win a fight at the congressional level, and you think you're done and everything's squared away. Well, that's not how it works, and AARP often has to continue to fight. And in this situation, the prescription drug companies actually had brought lawsuits against the new law to say that it was to try to defeat the new law. And we just heard from the Supreme Court within the past week or so that their claim to try to overturn the law was not valid, and so we succeeded again. So,
but we were ready.
Yes, we were ready. We were ready. Exactly. That's one of those ones that we would have had to fight more, but now we don't. But we always are looking out for anything that might come down the pike to threaten because those are really massive cost savings that are coming through Medicare now on prescription drugs.
The cap was $2,000 for prescription drugs, and I'll never forget. I share this story often. A woman that I met, she's now deceased. When we were talking about prescription drugs, her husband had died. He was a veteran, and he had died, and she had to sell her wedding ring in order to pay for her. They had been married for 62 years, and she was never there to be able to see this get crossed the finish line. But it's a real issue. So it's an issue that people actually rallied behind, and were successful. It took a while.
It took a while, and there's more work to do, because this is a tremendous help within Medicare, but these benefits don't, not all people who need prescription drugs, take these specific drugs, or, so some people who are on prescription drugs aren't on Medicare. So, there continues to be work to do, and there are fights at the state level in a number of different states where AARP is involved, pushing for various proposals that help kind of rein in the cost of prescription drugs, because we know, the prices of those drugs are escalating so much faster and we know inflation is out of control, but the cost of prescription drugs is even much higher than inflation right now.
I remember Senator Stabenow saying that diabetes drug hadn't changed in like 30 years, but the price had gone up like, I forget like 500% or something crazy like that. But it had never changed. So why would the price continue to increase when there was no? And we do love the pharmaceutical companies' research, in terms of new drugs and what's out there. But we fought Big Pharma and we won.
We did.
I'm just saying.
Yes, exactly. we did that. We did that.
We've got about 2 minutes left. I'd like for you to share with us, some states are getting it right. Maybe any states that come top of mind that are getting the caregiving, maybe did something with caregiving, did something with fraud, or so that, we're not, Michigan isn't unique. There are other states fighting the same kinds, and that's your national perspective. So
well, I can point to 2 wins that have just happened. A lot of states are in their legislative sessions or just have wrapped them up. I know Michigan's is ongoing, but a couple of great wins that I would point to. One is in Connecticut. They just passed a family caregiver tax credit. Exactly what Michigan is fighting for, and they got it done. And to the benefit of the family caregivers there. So I'd point to the Connecticut caregiver tax credit. There are numerous across the country. They aren't the first to do that, but they're the most recent. And then I would point to Indiana, your sister state to the south. We were talking about the crypto ATM and banning the crypto ATMs, and they did that. They started doing that locally and really pushed for that in a city in southwest Indiana called Evansville. Got a crypto ban passed there, and then were able to get it passed statewide through the Indiana legislature this session. So People in Indiana cannot be ripped off through crypto ATMs anymore because they're unplugged. They don't exist anymore.
That's fantastic.
Yeah.
People often think AARP is just all about insurance and discounts, but this is the work we do on the ground in communities all over this great country of ours, and it's up to our volunteers to help. Michigan, we have over 400 volunteers.
Yes.
It's just a phenomenal place. So again, look at those websites, visit those websites, and get involved and make certain that you know who you're voting for and what they stand for. Thanks so much, June, for being with us.
My pleasure.
It's always my pleasure to have you in the room with me. Thank you.
Thanks, Paula.
Hi, I'm Tracy Anderson with Impart Alliance at Michigan State University. Today I'm joined by Ashley Druger. Ashley is owner and director of Saugatuck Home Care Services, and she's here to talk to us today about the training she received at Impart Alliance.
Yes, thank you so much for having me.
Well, thank you for being here.
Of course.
Tell me a little bit about the takeaways from Impart Alliance training.
There was so much good information. They touched on all levels, things that I did not receive training in with my CNA certification. A lot of real life issues that we see every single day, the mental health crisis and taking care of people in those times of needs, and how to properly do that with respect and person-centered care.
Tell me about person-centered care and why that's so important.
It's individualized to each specific person's needs, and I feel like it makes them more comfortable. It makes them feel like a real person, and we're honoring them by individualizing their care to meet their needs.
Absolutely, and helping them live a quality life, which everybody deserves.
Absolutely, all the way through the end of life. And there is such a shortage for direct care workers in our state. And so it's just so important to get out there, and Impart Alliance makes it possible for people to be credentialized with that. And it's so important. It gives them the training to go out into the real world situations and be able to handle them professionally and appropriately.
Absolutely, and I would imagine confidence, right?
Absolutely.
Uplifting direct care workers to be confident out there.
Absolutely, it's so important.
Thank you, Ashley.
Thank you.
Long-term care, it is expensive. David, why is long-term care so expensive?
Paula, I can tell you very easily.
Okay.
You may remember from history class that there was this unpleasantness in the world, the late 30s to the mid 40s. It was called World War II. Mm-hmm. And when World War II was over, people were happy. They were so happy, right. Guess what they did? They had families, big families, okay? In fact, you might even say there was a baby boom.
Mm-hmm.
Okay?
I don't remember World War II. I wasn't there, but I understand what you're saying.
Well, from high school, that's what I'm saying. Yeah, it was
okay.
history,
All
I get it. But here's the thing. There are a lot of us boomers, a lot of us boomers, but we didn't have as many kids as our parents did. So now the demand for care, the demand is through the roof. The supply of caregivers bottoming out. So you tell me, what happens when demand goes up and supply goes down?
The cost goes up.
Exactly. That's why it's $40 at a mid-range agency now. It's $40 an hour to get the trained person to come, not a nurse, not an LPN, just anybody to come who's been trained to come and sit with you. So the range is $30 to $60 an hour. And if you want a registered nurse, it starts at over $100 an hour. That's what retirement law is focused on. You don't have to go broke. We can, and you've already paid for your long-term care. Question is, how do you take advantage of it?
That's fantastic information. People need to plan early.
Absolutely.
I appreciate that, David. Thank you so much for being here.
Thank you, Paula.
You've worked hard for your money, and you're hearing more and more about scams, and the more intelligent scams are out there. So let's talk a little bit about scams as we talk about retirement and our financial security, and what should we know and how do we protect ourselves. You know, we've earned this money. We want to keep it. What do we need to do?
Yeah, I appreciate the question. It seems to be coming up more and more often, doesn't it?
Yes, absolutely. It's scary.
Yeah, I would agree. I would start with trust your gut. If it doesn't seem right, it probably isn't. And trust in the counterparts, the professionals, the friends, the relatives that you have. Ask folks, hey, does this sound legit? Does this look legit? Because it does happen more and more every single day.
Are there ways to protect yourself? I mean, we hear things about people's deeds being stolen, and 10 years later, they find out that they don't even have the deed to their house, or their investments have been attacked and they don't know it right away. Are there ways that you can protect yourself from those types of scams?
I would start with, don't respond to anything that doesn't appear to be original from the sender, right? It's that first layer, that first level of approach. The IRS is never going to call you on the phone.
Right.
Don't answer those.
Right.
Oftentimes, pause, say, I'll call you back, and then just make sure that the phone number you find online or on your bill is directly attached to the person that's calling you. That first line of defense, that first level of awareness, if you will, of this doesn't sound legit, would be the first place to prevent problems from occurring.
And people should avoid putting too much information on social media as well, right?
Yeah, it's generally a good practice, I would say.
Yeah.
The less somebody else knows about you, probably the better.
Yeah, that's why I'm a private person. I don't do TV or TV.
Right.
Thanks for being here. Appreciate that information. Thank you. If you're thinking about local transportation or public transportation, then Geneva's here, who is a member of the Local Advisory Council for CATA, to tell us and give you some advice on why you should consider local transportation. Thanks for being with us, Geneva.
Thank you for having me.
So tell us, why should people consider or think about their local transportation as an option?
Well, there are several reasons. One reason is if you don't have a car anymore and you need to get from point A to point B, you can always call them, schedule an appointment, and they will come and pick you up. I've used them for when I had shoulder surgery and I had to be at the hospital. I think it was 6 in the morning.
Wow.
CATA was there. They came to pick me up.
And it's not always the bus that comes. People think of CATA as the buses they see going up and down the street. They have a van that will pick people up, right?
They have vans that will come and pick you up. And they also have another bus that if you're in a wheelchair, then they can come and pick you up with that bus. They have a lift that they lower down and they put you on there and they take you where you want to go and try to get you there on time.
That's fantastic. That's better than I do on my own. And are they affordable?
They are very affordable. For me, for a round trip, it's $5.
Nice.
You're going to pay that. If you go to Vegas, you're going to pay that for a one-way trip on the bus, and that's the big bus. And even in Detroit. Because I'm cheap, I say that's expensive, okay?
Well, because you're frugal, right?
Yeah,
You're
but
wise. Well, thank you for that. So people need to consider their local transportation and particularly consider CATA. It's here for you. Thanks, Geneva.
yes, and thank you for having me.
This is a busy year, and it's up to you to make certain that your vote counts. Know the issues, know exactly how your elected official, your candidate stands on those issues. Thanks for watching Real Possibilities.